Here's what happens under the block grant approach for the state of South Carolina. Under Obamacare, we're getting $694 million a year to support exchanges that are failing. Under the block grant approach, by 2026, we'll get $1.5 billion to be used by the state of South Carolina as flexible as possible to design healthcare systems unique to our state. It is an $855 million increase, or 123% over the dollars Obamacare gives South Carolina. How can that be? This is what happens when you level out funding for all 50 states. Instead of 46 states getting 60% of the money, we're going to allow a new way of doing business where every state gets the same per patient share. What will this do over time? It will give South Carolina more money to deal with health care at the state level and more flexibility. I would suggest that the best way for South Carolinians to receive health care is from people that are accountable to them, not some Washington bureaucrat running Obamacare in DC. The big benefit of this block grant approach is that under Obamacare, I don't know who you complain to if you don't like the coverage you're getting. I don't know who you complain to when you're down to one exchange with a 30% increase. Faceless bureaucrats, people you'll never meet, run Obamacare. Under the block grant approach, I know exactly who you would complain to. The state would be in charge. Your state house representative you could go to and complain. The governor of the state of South Carolina would be held accountable. In other words, under the block grant approach, the people you would complain to are the same people that go to the hospitals that your family goes to. Chances are that a state representative is using the same doctors and hospitals as your family would be. And the governor of South Carolina would be held accountable for this $1.5 billion. What I think will happen over time is that 50 states will try different ways of delivering health care, and we'll learn what works. The one thing I can tell you that doesn't work is Obamacare. It will never work. It was designed, in my view, to go to a single-payer healthcare system by making insurance so expensive that the exchanges would fail and the federal government would come in and take over. That's exactly what's happening. Under my approach, that will be the end of single-payer healthcare in America, because the money and power will not be in DC, it will be in the hands of the 50 states with as much flexibility as possible. So from my point of view, this empowers the states to make decisions that are best for the patients in their states. If you believe government closest to the people is the best form of government, then I would argue that health care closest to the patient is the best form of health care. It will end single-payer health care because the money and power will be out of Washington. The only way single-payer health care works is to consolidate health care under the umbrella of the federal government with a printing press, because single-payer health care will break the bank. You see it happening with Obamacare. Under this approach, we block grant the money, we allow inflation, we allow for growth, but we cap the growth in year 8. For the first time, we're going to put a cap on healthcare spending in Washington, which will make it more sustainable. There'll be 2 block grants. One for traditional Medicaid in year 8, there'll be an inflation cap on it. It will be generous, but it will be more sustainable. The second block grant would be all the money we would have spent on Obamacare in Washington to be block grant to the 50 states, achieving parity over time. For us in South Carolina, it's a 123% increase in federal funding to help us with our health care needs here. From the political point of view, I hope by the end of the month to have at least 25 governors on board for the block grant approach. President Trump, I talked to a couple of days ago, he really likes this idea. We take up health care again in September. I think it would be a huge mistake for the Republican Senate to move on from health care. My goal is to get this approach scored by CBO so you can tell exactly how much it cost. If you eliminate the individual employer mandate, 14 million Americans would drop coverage because they don't have to pay a fine. That's not losing coverage, that's their choice. So I'm excited about understanding how this scores in the eyes of the Congressional Budget Office. We'll have hearings on my bill in September in Lamar Alexander's Help Committee, and I will give everybody in the Senate and the nation a chance to absorb what we're doing. You'll have a formula you can look at and see how you do in each state. Some states, over time, are going to have to will get less funding than they currently get, only because they get so much more than other states to begin with. We're trying to do this in a fashion where New York, California, Massachusetts, and Maryland have many years to get to where other states are going to be. In South Carolina's case, we get money to bump us up because we're left behind in Obamacare, and other states are going to have to ratchet down, and the goal is